How long is this procedure around? How long is...
Well, let's back up a little bit and explain the vampire breast lift itself. What that involves is taking PRP, which is platelet-rich plasma, which I take a sample of blood from your arm, I prepare the PRP, I concentrate it down, and then I activate that. I set that aside, and then I use another injectable called Juvederm or Voluma, which is a hyaluronic acid, and then I use those and I inject that into the breast, into the areas that we've mapped out, and then I inject the PRP on top of that. That being said, that's the vampire breast lift. Your question is, how long has it been around? The vampire breast lift has been around in some form, not known by the vampire breast lift, for about 10 to 15 years. In fat injection, people would harvest fat and then use that fat to augment the breasts. Back in the 80s it started. Then a lot of the doctors, as a regular course of their practice, they found that fat, when it was transplanted into the breast, had about a 39% take. Not really great, but still okay, but when they augmented it, when they added the PRP, those rates jumped up to about 60–69%. So it's been around for a long time. Dr. Charles Runnels, the man who formalized this procedure and tested it, he's been using it for about 7 years now.
Nice. Is it safe?
Of the thousands of articles that have been done and written on lipofilling with fat or PRP or the combination, we found no evidence, no literature papers that have demonstrated that there has been any increase in cancer. Now, in fact, this month, February of 2016, there's an article out in the Plastic and Reconstructive Surgery Journal that states unequivocally the study showed no increase in reoccurrence, occurrence of primary or any secondary breast cancer with the lipofilling. So I can say that there has been no papers, and in our experience we found no increase in the rates of cancer with this procedure.
Nice. Does it hurt? Will I lose any sensation in my breast?
Good question. A lot of ladies have reported increased sensation. In fact, some ladies after getting breast augmentation or getting any other sort of breast surgery or breastfeeding have decreased sensation in their nipples. They've come to us and we've used this procedure injecting the activated PRP. We've increased the sensation in some of these ladies.
Any special instructions after the procedure? What's the recovery time?
Recovery time, just like a lot of the minimally invasive procedures, it's anywhere from 1 to 3 days. Your breast might be a little bit sore because of the injection, might feel a little bit full because of the PRP and the hyaluronic acid that we're injecting, but a lot of ladies go back to work the exact same day. In fact, some doctors encourage the patient to, after the procedure, to go out and go swimming and have fun and just live life normally. There's no really restrictions. My only restrictions are, I like my patients to limit alcohol and exercise for the first day or so.
You could do that. How about the results? Are they going to be similar to breast implants?
Good question. To differentiate between a breast implant, which is going to augment the breast and make it bigger and fuller, what this does is more of a finishing or a polishing effect. We take that PRP and the hyaluronic acid and we're going to finish off and make the breast more rounded, more medially, where the cleavage is. When a lady wears an evening gown or a sexy dress, they'll use it so their cleavage will be more exposed. What this does is it'll augment that cleavage area, so it'll give your breast a more polished look, more full.
So if I had a breast implant, could I still do the procedure?
As I said, it's a finishing procedure. It polishes off what the breast augmentation does. It's not a replacement for the breast augmentation or the breast implant. It just finishes it off. Sometimes with the breast implants, there'll be a little depression or a little lack of volume on one side or another, or an asymmetry. What this does is we're able to use the vampire breast lift to augment, to fill those in, to finish the breasts.
And how's the procedure performed?
We spin down the blood, as I explained to you before. We separate out the platelets. We activate the platelets. We take the Juvederm or the Voluma, the hyaluronic acid. You're holding a mirror and you draw on your breast. I've drawn your breast, I'm sorry. In a mirror, we look at the areas of the breast that you think that you want more full, primarily in the medial part of the cleavage. I will use a grease pencil. We will mark those areas out. I'll put your bra back on so you can see how that cleavage would look after the procedure is done. And then we go and we numb your breast with a numbing cream, which is quite effective. After the numbing cream, which is on there for about 20 minutes, we take it off, and then we inject the hyaluronic acid. Now, the hyaluronic acids we use have lidocaine, which is a numbing agent inside of them. When that goes in, there's virtually no pain, minimal pain. After we lay down the scaffolding with the hyaluronic acid, then we go in and we inject a PRP on top of that. And that PRP then will use the hyaluronic as a scaffolding. It will stimulate the release of the growth factors, the stem cells, and it will augment the time that the hyaluronic acid will last. It usually lasts about 1 to 2 years, and the volume loss is very gradual.
So talking about the numbing cream, is it only local anesthesia or is it general?
No, it's local. It's a numbing cream. It goes topical, and it penetrates into the skin. It doesn't have to penetrate that far because once we do the lidocaine fill, the hyaluronic acid, it's going to get rid of most of the pain that you would experience. So it's a pinching you'll feel.
So how long will it last? How long will my breast, will it make it bigger, my breast?
Well, it's going to round them off. It's going to round off the breast immediately. It'll make the cleavage look more full. It'll give you a more full look. And if you had breast implants, it's going to make the breast implants appear larger, but it's just going to be more full medially. It's a polishing effect, as Dr. Ramos likes to call it. And like I said, it'll last 1 to 2 years depending on the patient, your activity level, metabolism, and things like that.